Hello and good afternoon friends, welcome to the CEC-UGC live lecture. Dear friends, with our ongoing series on medical diagnostics, today we will be talking on cancer biopsy in the first half, whereas in the second session we would be discussing on urine and blood test. And for this discussion we have once again with us in our studios Dr. Amit Bhattacharya. Dr. Amit Bhattacharya is an Assistant Professor in Department of Zoology, Ramjas College, University of Delhi. So dear friends, let's welcome our guest Dr. Amit Bhattacharya and let's try to grab maximum knowledge through his experience. Hello sir, welcome to the lecture.
Thank you very much. So good afternoon dear viewers. In this first part of the lecture I will be talking about cancer biopsy. So cancer biopsy is one of the most important tests or the diagnosis test which is then done whenever the patient is suspected with any form of cancer. So before going into the cancer biopsy, I will just take up a brief overview what exactly cancer is and what are the various stages of cancer. So cancer is actually a uncontrolled growth or the abnormal growth of the cells. So it can grow at any parts of the body and it grow abnormally. Many a times what happens is after the abnormal growth of these cells, they may migrate from one part of the body to the other part of the body, and this process is called as the metastasis. So the WHO has defined cancer as the rapid creation of abnormal cells that grow beyond their usual boundary, which can then invade adjoining parts of the body and spread to other organs also. Now, if we see the WHO reports and the latest data, it says that in 2012, about 8.2 million people worldwide died because of cancer. 60% of world's total new annual cancer cases are reported from Africa, Asia, Central and South America, and about 30% of the cancer could be prevented. So cancer is not a dreadful disease. If it is detected, it can be diagnosed and treated at a very early level. It is curable. Now, if we see the statistics of the different cases or the mortality cases in the various regions of WHO, we can see that in the worldwide region, then the WHO regions have been divided. So the Indian statistics are also shown. Majority of the cancer cases, both in the men and the women, are from the more developed region, less developed region than the more developed region. So we can see from these estimates, which is given in thousands. Now, cancer is one of the leading cause of death worldwide. According to this, about 8.2 million deaths have occurred in 2012. The most common cause of cancer are cancer of lung, in which about 1.5 million deaths occur, liver cancer, in which about 7,45,000 deaths occur, stomach cancer, colorectal cancer, breast cancer and esophageal cancer. So all these are the cancer which are the most important widespread cancers across the global region. Now, if we take the overview of the tumor formation first takes place with the process called as mutation. So in the mutation process, what happens is a series of mutation at the DNA levels or at the various metabolic levels occurs, due to which there is a restraints which were present on the cell divisions gets removed. So the tumor growth start taking place. So each of these cells in our body have got a definite lifespan. So after that lifespan, this cell will die automatically by the process called as apoptosis or programmed cell death. But in cancer cells, what happens is this apoptosis process doesn't occur, or it evades this apoptosis process. So the tumor growth occurs, the tumor cells loses its organization and proliferate quickly. So a mass of cells is formed and the angiogenesis process also start taking place. Now, the third step which occurs is called as the intravision, where these malignant cells which were localized at one position spread through the blood vessels and the lymphatic vessels to the other part of the body. And in the fourth stage, what happens is the metastasis occur, the malignant cells become established in the distinct organs. So, if we see the structure over the image over here, we can see that the tumor cells were formed at one part of the body, and after the mutation, tumor growth, intravision, the metastasis has occurred and it has moved from one part of the body to the other part, and subsequently the metastasis or metastasized cancer develops throughout the body parts. Now, if we see the animation over here, this animation shows how exactly things happen. So, there is a mutation which occurs, due to which there is a uncontrolled growth of the cells occurs. Now, these uncontrolled growth cells get released from their position, move through the blood vessels into the other parts of the body and causes the metastasis stages. So, these are the various stages of tumor growth and metastasis which occurs in the cancer cells. Now, the angiogenesis process is one of the most important and prominent process in the cancer biology. So, angiogenesis actually means the formation of new blood vessels. So, whenever the cancer cells start getting formed at one part of the body, which are called as the primary tumors, what happens is the blood vessels which are adjoining or near to these cells, they start forming new blood vessels, so that the freshly formed mass of cells can get the food and the energy sources. So, these blood vessels are formed, these new blood vessels are formed so as to provide the food and the other sources to these mass of cells, and this process is called as angiogenesis. So, in the image we can see that first there is a primary tumor, subsequently the blood vessels start getting formed from the already existing blood vessel, and finally a mass of blood vessels are formed within this mass of cell structure. Now, there are four major types of tumors which are there. The first one is called as the carcinoma, which is the most frequent type of cancer, and it is generally occur because of the transformation of the epithelial cell lining organs or cavities or surfaces. The example of these types of cancers occurs in lung cancer, colon cancer, breast cancer, prostate cancer. Now, the second one is called as the sarcomas, which are mainly related to the mesenchymal tissues, mainly fibroblast and the related cell types. So, the examples are the bone and the muscles cancer. The third type of cancer are called as the hematopoietic cell and organ cancer, which includes leukemia, lymphomas, myelomas. So, they include the leukemias, the blood cancer and the blood related cancers. The fourth type of cancer is the neuroectodermal cancer, which includes neuroblastomas, glioblastomas, melanomas. So, all these types are the various four major types of tumors. Now, if we see the positioning of these types of cancer, the carcinomas are generally mutations which occurs in the cells that covers the internal or the external body surfaces, which includes lung, breast, colon, bladder, prostate cancer. Now, the other cancer is the leukemia, which involve the blood cells, then the lymphomas, which includes the lymph nodes and the tissues, and the sarcomas, which includes the cells in the supportive tissues, bones and muscles. Now, how exactly these cancers are diagnosed? So, one of the most important technique of diagnosis of the cancer is called as the cancer biopsy. So, cancer is nearly or always diagnosed by an expert who looks at the cells or the tissue samples which have been collected from the patient. So, the tissue samples is observed under the microscopes. Along with that, there are different tests which can quantify the DNA structure, RNA sequences, everything, and there are various other imaging techniques also which can diagnose the cancer. So, all these techniques and the tests go in hand to hand. Now, these tests of cells and tissue can find out what kind of disease it is, whether it is a cancerous or non-cancerous disease. So, the procedure which takes out a piece of lump or a sample for testing from the patient is called as the biopsy. Now, when it occurs in the case of cancer, it is many a times referred as the cancer biopsy. The tissue sample which is taken out is called as the biopsy specimen, and the testing process is many a times referred as the pathology process. Now, in the older ways, what used to be done is the patient's tissue samples or the cell samples were taken out, and then these tissue samples were observed microscopically or histochemically. The various pathway tests are done, and they were done under the pathology exercises. Now, in the advanced genomics and proteomics sciences era, what has happened is the patient's tissue sample or the blood samples are taken up, then the proteomic studies are done, in which the protein analysis are done through the various techniques such as the mass spectroscopy, proteomic images. Then the genomic studies are done, in which the DNA, RNAs are checked with the help of the various technologies which are available, which includes gene chip, microarray technologies, DNA sequencing. So, all these technologies confirms that which stage of the cancer it is, or whether the patient is into a cancerous state or non-cancerous state, and if it is in a cancer stage, which stage, whether the metastasis has occurred or not. So, the science has advanced to the next level, where all these proteomic and genomic studies are being done along with the microscopic and specimen studies. Now, let's go into the various types of biopsy which are available to diagnose the cancer. So, as we studied, biopsy is basically a procedure to remove a piece of tissue or specimen of cells from the patient's body, so that it can be observed under the laboratory condition as well as in the microscopic slide. So, there are various imaging tests are also available, such as the X-ray, PET scan, MRIs, ultrasound, which are helpful in detecting masses and area of abnormal growth. So, these imaging techniques are used along with the biopsy technique, so as to confirm that the samples are taken up or collected from the appropriate positions. Now, before going into the biopsy, let's discuss some of the imaging techniques which are available. One of the most important imaging technique is called as the PET or the CT scan. So, PET scan means positron emission tomography scan, while the CT scan means computed tomography scan. So, these scans, CT scan is generally recommended for other diseases or infections also, but PET scan is generally recommended in the case of cancers. So, this PET scan, what the doctors can identify is, they can detect and determine the stage of cancer. Second, they can determine whether the metastasis has occurred. Thirdly, they can evaluate the effectiveness of the cancer treatment which starts in the patient who is diagnosed with the cancer. Now, this is the image which is showing the PET scan of a metastatic cancer. So, we can see there are lumps which are showing bright in color. So, these are the lumps which have got metastasis. So, we can see these lumps in the lung region, liver region and bone region. So, this is a metastatic cancer which has occurred and which has spread to the various distant part of the body through the blood vessels and the lymphatic systems. Now, the various types of the biopsy which are generally used to look for cancers have been classified into various categories. The first and foremost is called as the needle biopsy. There are two types of needle biopsy which are there. The first one is called as the fine needle biopsy, which includes, which is also known as the fine needle aspiration. Then the second form of these needle biopsy is the core needle biopsy, which is also called as the core biopsy. Then the second form or type of biopsy is the excisional biopsy or incisional biopsy. Then the third type is the endoscopic biopsy. Then comes the laparotomy, thoracotomy. Then the skin biopsies occurs. Then there are sagittal lymph node mapping and biopsy. So, all these are the various different types of biopsies which are available, which are done according to the cancer type which has been detected. So, we will come into all these detailings of all these biopsy one by one. Now, we first go into the needle biopsy procedure, which includes various forms. So, needle biopsy have been further divided into a number of types. The first one is called as the fine needle aspiration biopsy, in which a thin and long needle is inserted into the suspicious area where a lump formation has occurred. So, through this fine needle and syringe, what is done is the fluid or the cells are drawn out for analysis and further studies. And the second form of the needle biopsy is the core needle biopsy, in which a large needle is inserted which contains a cutting tip at the end. So, what happens is it helps the doctors to draw a column of tissues out of the suspicious area. So, in this core biopsy, we can take out a tissue or a part or lump of the cell for proper analysis and subsequent analysis. The third type is called as the vacuum assisted biopsy, in which a suction device is inserted so that the syringe or the is not required. So, with the help of the suction device, there is an increased amount of fluid and the cells that can be extracted through the needle. So, this reduces the number of times the needle has to be inserted at the area to collect a proper amount or the appropriate amount of sample. The fourth type of needle biopsy is called as the image guided biopsy, in which along with these biopsy techniques, the various image procedures are also used, which includes X-ray, computerized tomography, MRI, which is magnetic resonance imaging, or ultrasound or PET scan. So, all these image guided biopsies are done when they detect that the stages might be metastatic or have passed down to the other stage, other parts of the body also. Now, we first come into the needle biopsy. So, needle biopsy is often used on the tumors in which doctor feels through the skin. So, there is a suspicious lump or the enlarged lymph node, mostly in the case of the breast cancer and the lymph node cancers. So, this particular needle biopsy is combined with a image procedure such as the X-ray, CT scan, MRI scan, so that a adequate number of the cells from the suspicious area can be collected without doing a number of incision into that particular area. Now, if we see the image over here, this is showing a needle biopsy which is assisted by imaging procedure. So, the needle biopsy is basically, we discussed that it is a medical test in which a needle is inserted into the area where the lump is suspected to be present. So, in that particular lump, the cells are extracted or aspirated out with the help of the needle and the syringe. So, we can see over here the lump from the liver, the lungs part of the body is being taken out, along with the insertion is being done with the help of the imaging procedure, so that the proper insertion into that particular suspicious area is done, and it is done correctly, so that the relevant and adequate amount of the cells from the suspicious area can be extracted out for further analysis. So, image biopsy is one of the most critical biopsy which are done in the cancer suspicion along with the image guided techniques. So, the first biopsy we go into is called as the bone marrow biopsy. So, bone marrow are the part of the body in which a very vital process takes place, which is called as the hematopoiesis. So, hematopoiesis is the process through which the various blood cells and WBCs, RBCs and all the granulocyte, agranulocytes are produced over there. So, they are very important procedure in our body circulation and defense mechanism. So, if the bone marrows within a body is affected, the blood immune system and the immune system of that particular patient goes out. So, the bone marrow is a very important part. So, whenever a patient is suspected with a bone marrow cancer or leukemia, lymphomas cancer, which are the cancer of the red blood cells or the white blood cells, the doctor immediately recommends for a bone marrow biopsy. So, the bone marrows are generally present in within the bones parts. Many of the bones have got bone marrows or the surfaces in which the hematopoiesis start taking place. So the bone marrow is basically a spongy material inside the larger bones such as the femur bones, where the blood cells are produced with the help of the process which is called as the hematopoiesis. So analyzing the bone marrow samples, then subsequently diagnosing whether this particular case is a cancerous case or not, and if it is a cancer, whether it is a metastatic state or not, is done. Now, if we see the image over here, this image shows the bone marrow biopsy. So, in the bone marrow biopsy, a needle is inserted into the bones. So, through these needles, what happens is the aspiration is done. So, a small amount of liquid from the bone marrow is collected, and we can see this bone marrow biopsy over here is done from the back of the hip bone. So, a bone marrow biopsy is often is a piece or tissue is maybe also can be collected from that particular area. So, thus bone marrow biopsy, a part of the bone marrow cells or the growing cells or the hematopoietic cells are collected for further analysis. Now, if we see, these are the histochemical slides or the pathology slides which have been prepared from the bone marrow collected samples. So, the various slides are prepared, they are stained with the help of the various dyes, and the immunochemistry is done. So, over here we can see hematoxylin eosin stain which is being done. Then there are various immunostains which are available, which can target or detect the characteristic cells which are present in that particular type of cancers. Then the various kappa light chains or the gamma light chains can also be detected. So, these are the slides which are prepared from the bone marrow collected sample, and then they are observed under the microscope whether the patient is having any cancerous state or not. Now, the next biopsy we go into is called as the endoscopic biopsy. So, in this endoscopic biopsy, the doctor inserts a thin flexible tube which is many a times referred as the endoscope, with a light or a torch present at the end to see the structure inside your body. So, these are the special tools which are inserted through the mouth area, and these kind of biopsies are generally done to examine the esophagus, stomach, and the small intestine, especially the duodenum part. So, in this part we can see in this image a endoscope is inserted from the mouth area. It goes through the gastrointestinal tract, and we can examine the gastrointestinal tract and observe what exactly is happening over there, and if there is any cancerous formation which is taking place or not. Then the next type of the biopsy is called as the male cytoscopy. So, in this cytoscopy, the doctors generally what they want to do is they want to observe the urinary tract, mainly the urethra and the bladder region. So, the doctor what they do is they insert this endoscope or the cytoscope through the urethra, and then subsequently they observe the bladder and the urethra region. So, they can find out if there is any urinary tract abnormality or infections or cancerous state which is forming over there. Now, the next type of the biopsy is called as the colonoscopy. In this colonoscopy, the doctor insert a colonoscope into the rectum and check the abnormalities in the entire colon part region. So, this colonoscopy is majorly done to check if there is any abnormality or abnormal formation of the cell in the colon region or not. Now, the next type of the biopsy is called as the thyroid biopsy. So, in this type of thyroid biopsy, what the doctor does is during the thyroid biopsy, the doctor uses a needle to remove a small amount of suspicious tissue from the thyroid gland. A ultrasound transduction is also used along with the thyroid biopsy. So, this is a image guided biopsy which is being done. So, a ultrasound, what it helps is, it helps the doctor to properly insert the needle into the thyroid gland, because thyroid gland are very small gland which are present in the throat region. So these gland has to be properly inserted so that the cells from the proper suspected regions can be collected. So the ultrasound transducer is generally used to create an image that helps the doctor to put the needle into the suspicious area. Now, the next types of the biopsy are called as the core needle biopsy. So, in this core needle biopsy, what is done is there is a long hollow tube which is inserted with the help of the needle, and at the tip of the needle there are cutting edges which are also present. So, in the core needle biopsy, a part of the cancer suspicious part or the lump is taken out. So, instead of taking out or aspirating out the cells or the fluid or the liquid from that particular region, in the core needle biopsy a part of the lump is taken out. So, over here we can see a breast cancer needle biopsy which is being done. So, whenever there is a suspicious breast lump which is observed, so with the help of the ultrasound the image are created, and then the needles which contains the cutting edges are inserted to that particular area, and the mass from the breast is taken out or aspirated out, which for further analysis. Now, the next comes is the liver biopsy. So, liver biopsy, as the name suggests, is whenever the person gets the intimation that there is some kind of liver abnormal functioning which is taking place over there, then the doctor recommends that go for a liver biopsy. So, in the liver biopsy, a small sample of liver tissue from the patient is removed, and then this liver tissue is cryopreserved and subsequently sent into the laboratories for a proper treatment. So, in this liver biopsy we can see a thin needle is inserted into the skin, through the skin into the liver area part, and subsequently a small sample of liver tissues is collected for laboratory testing. Now, we discussed about the various standard biopsy techniques as well as the liver biopsy techniques. So, there are various standard biopsy techniques in which these samples, the cell samples are collected or the cell mass from that particular suspected area are collected. So, in the standard biopsy techniques have got lots of advantages over the liquid biopsy, while the liquid biopsy also have got some advantages. So, the standard biopsy techniques which we discuss, they are invasive techniques, most of them are invasive techniques. Then the localized sampling of the tissues can be done. They are not easily to be obtained because inserting the needle into the suspicious area is very tough. So, many times they are guided with the image procedures also. Then they are painful and risky also, and majorly they are invasive. Now, the liver liquid biopsy techniques are majorly in which the blood or the samples are taken up, so they can be easily quantified or checked in the laboratories. They have got minimum pain and risk which are involved, so they are minimally invasive and they are easily obtainable. So, these two biopsies are generally recommended depending upon what type of cancer it is or what stage of cancer it is, and subsequently there are various imaging techniques which are also there which help the doctor to confirm the various diagnosis and subsequent treatment, whether the treatment which is given to that particular patient is going in a correct direction or not. So, all these treatment procedures are also checked by the various imaging processes, like the PET scan is done when the chemotherapies are being done. So, regularly after chemotherapy sessions the PET scans are done so that they can check that whether these lump of cancer masses have got reduced or they have been evaded out from the body circulations or not. So, in this part of the lecture we discussed about what exactly cancer is, what is a metastatic stage, and then we discussed about the various types and forms of the biopsies along with some of the images, how exactly these biopsies are being done. So, with this note I end my lecture over here. Thank you very much. afternoon dear viewers. In this part of the lecture under medical diagnosis, I will talk about urine analysis and blood tests. So in the first part of the lecture, I will talk about what exactly urine analysis is. Then subsequently, I will go into the blood test procedures. Now, urine analysis is basically a urine test which is being done in which the urines are being checked. So what exactly urine formation is taking place, how exactly this urine composition is changing in the patients or the suspected individual. So this urine analysis gives us an idea about the various ailments such as the urinary tract infections, kidney disorders, liver disorders, and many a times of the various metabolic disorders also. So urine analysis is a very important technique in the medical diagnosis. Now, urine is, we know, all of us know that urine is a waste product made in the kidney. So urine analysis takes place with the help of this taking up the urine from the patient or the person whose test has been done. So a routine test of urine analysis gives a doctor an idea that whether the person is suffering from various urinary tract infections or the kidney or liver infections or not. Now, why exactly these urine analysis is being done? So urine analysis gives us a idea about the various diagnosis conditions such as the urinary tract infections, kidney disorder, liver problem, diabetes, and many metabolic disorders also. So the urine analysis has been divided into the various types. The first urine analysis is the chemical urine analysis, then comes the microscopic and visual examination. So in each of them, what the pathologists detect is the cells, what are the cells which are present, the cell fragments, substances such as the crystals or the cast which are involved, whether there are a presence of red blood cells or the various other types of cells into it. So we will discuss about all these one by one. Now, many a times these urine analysis is being done for the pregnancy checking and the various other ailments such as the urinary system problems also. So what does the result mean actually? So urine analysis is a very important analysis which has to be done in the case of the chronic disorders, but many a times this results has to be substantiated with the other analysis such as the comprehensive metabolic panel analysis, complete blood count analysis, renal panel, liver panel, urine culture analysis. So all this urine analysis has to be substantiated with the other analysis or the tests which are available. So the urine analysis is done with the help of the urine. So before going into the urine analysis, let's talk about what exactly urine is made up of. So we know that urine is a complex fluid which contains about 95% of water and 5% of solid. So urine is basically an end product of the metabolism which is carried out by the billions of cells which are present in our body, and every day we have got an output of about 1.5 liter per day. So urine may be formed or contains various cells, cast, crystals, mucus and bacteria. So all these things are detected with the help of the urine analysis. So if we see the image over here, 95% of the urine, in urine 95% is made up of composed of water, while the 5% remains to ammonia, sulfate, phosphate, chlorine, magnesium, calcium, potassium, sodium, creatinine, uric acid and urea, of which the urea is of the highest percentage. Now, from where exactly these particular substances are coming up? So the 5% solute contains urea, which is majorly formed from the breakdown of the amino acid, while creatinine helps to regenerate the ATP and are present in a larger number in the skeletal muscle cells, while the uric acid are generally formed by the breakdown of the purine. So all these compositions are shown over here and how exactly they form the urine. Now, in the urine analysis, as we discussed, is divided into three major forms. The first one is the physical analysis, then comes the microscopic analysis, and the third one is the biochemical examination. So in the physical examination or the visual examination, the doctors look for the volume, color, odor, reaction or the pH and the specific gravity. While in the microscopic test, in the urine, the doctor looks for crystals, cells, microorganism, parasites, or if there is any contamination over there. In the biochemical examination, the doctor looks for proteins, sugars, ketone bodies, bile salts, bile pigments, and blood cells also. So these are the three major forms of the urine analysis. So we'll come into each of these forms one by one. So the first form is called as the visual analysis, in which the color of the urine is generally checked. Mostly the urine is generally colorless to yellow or very pale color nature. Now in many of the cases, many of the diseases, the urine color changes. So we'll see some of these changes, how does it occur. Then comes the clarity, how clear the urine is. So depending upon the clarity, the pathologists determine whether it is clear, slightly cloudy, cloudy or turbid. The normal urine can be clear or cloudy. So in many cases what happens is, when the urine becomes turbid or too much of cloudy, there may be presence of red blood cells, white blood cells, bacteria. So they requires a attention at that point in time, because the proper diagnosis and the treatment has to start. Now if we see the color representation of the urine over here, the normal urine, as we said, is generally clear to transparent yellow in color. So the dark yellow urine generally shows that the person is having normal metabolic processes but is in a need of water soon. So the person is dehydrated. While the brown yellow shows the severely dehydrated person, or he or she may be suffering from liver diseases also. Pink or red urine shows that the person might have eaten beets or blueberries, or there may be blood in the urine also. Now the blue-green urine shows that there is some rare genetic disorders, or the bacteria or some medication or food dye which has contaminated the urine. The orange urine shows the person is dehydrated or having a liver or bile duct abnormality, or there is some food dye which has taken place. So these all colors represent what kind of state the person is. Now we go into the next one, which is called as a chemical analysis, in which the chemical tests are being done and they substantiate whether the person is having which kind of readings. Now in the chemical analysis, the various reagent test strips are being used, and these test strips, what they do is they help or enable the doctors or the pathologists to specify what is the specific gravity, what is the pH, what is the protein content in the urine, the glucose, which is very essential, determining the glucose in the case of the diabetic patients, then the ketone bodies, then the hemoglobin, myoglobin, leukocyte esterase, nitrite, bilirubins, and the other content. So in the chemical examination, all these tests are being done, for which reagent test strips are readily available in the market, through which they can see the color change, and they can identify with the help of the color change the reading, what exactly the reading is coming up. The third type of the examination in the case of urine analysis is the microscopic examination. So in the microscopic analysis, what they do is they take out the urine sediment. So the urine is centrifuged, the supernatants is discarded, while the palate is taken up. So the palate can contain the red blood cells, white blood cells, or there may be some crystals, or there may be some microorganisms in that particular thing. So from that palate or the urine sediment, these slides are being prepared. So once the slides are prepared, they are then observed under the microscope, and then the number is observed, and it is reported per lower field or LPF, or per higher power field or HPFs. Now in the microscopic examination, the doctor generally observes for the red blood cells, whether there is a presence of red blood cells or not, white blood cells, epithelial cells, or whether there is some microorganisms such as bacteria, yeast, or parasites which is present, trichomonas, there are some crystals which are getting formed over there or not. Now if we see some of the images over here, this image shows the urine analysis which is being done with the help of the microscope. So this shows that there are bacterial infections over there. So we can see the rod shaped structure bacteria as well as presence of WBCs. Now in the next microscopic examination image, if we can see that the red blood cells have appeared and the white blood cells are also present. So this gives us an indication that the person might be suffering from some disorder. So the presence of the red blood cells in the urine is many a times referred as the hematouria. So the red blood cells generally or normally the shape is swollen by in the case of the diluted urine, while in the case of the concentrated urine they are crenated. So we can see a crenated RBC in which the concentrated urine is there. Now the presence of dysmorphic or the odd or the abnormal shape of the red blood cells in the urine suggests that the patient might be suffering from some glomerular disease such as the glomerulonephritis. So along with this urine analysis, the doctor recommends certain other kidney functioning tests also, which can be done and which can substantiate the results which have been shown by the urine test. Now over here in this image we can see the various red blood cells, WBCs, the various crystals which can be seen under the microscope. So in this image, if we see over here, the white blood cells are being seen in the urine which is being observed under the microscope, then the epithelial cells can be observed, then the red blood cells can be observed, the tyrosine crystals have been observed over here, then the calcium oxalate are observed, then the crystalline crystals which are observed, cholesterol crystals which are observed, and the uric acid crystals which are observed. So all these things are observed under the microscopes, and if they are being shown into the urine or the normal urine, then the pathologist or the doctor recommends to go for another test so that that particular disease condition can be confirmed or rectified. Now in the urine sediment which is being taken up, the cells which are generally observed are the white blood cells, red blood cell, epithelial cells, and the fat bodies, which includes the cholesterol cells or not. In the cast cells, the white blood cells, red blood cells, granular, fatty acid, renal, vaccine and hyaline cells are observed. Then in the crystals, in the normal form, the uric acid, calcium oxalate, triple phosphate, calcium carbonate, calcium phosphate and ammonium butyrate are observed, while in the abnormal cases the leucine, tyrosine, cysteine, bilirubin, cholesterol, sulfonamide, all these crystals can be observed. So these things can be observed. Then if there is any presence of microorganism which can be observed, which includes yeast, parasite, sperms, bacteria, fibers or starch, and the disease which can be associated with the observing of all these things into the urine analysis, the patient might be suffering from glomerular nephritis or nephrotic syndrome, which includes the kidney disorders or lower UTIs also. Now these are the various crystals which can be observed. The uric acid crystals which is promoted by acidic urine, so they are generally observed in tumor lysis syndrome. Then the calcium phosphate things which are observed in many of the disorders, magnesium ammonium phosphate which are seen in the UTIs and the other disorders. Then the calcium phosphate crystals which can be seen, calcium oxalate crystals can be seen, which is generally observed in the ethylene glycol ingestions. It is observed in the cysteine things are observed. So to quickly summarize these things, the normal color of the urine is colorless to dark yellow or amber color. The urine specific gravity ranges between 1.003 to 1.03. The normal pH range generally ranges from 4.6 to 8 pH with an average of 6. Generally there is no detectable urine glucose, nitrites, ketones or proteins which are present. In a normal urine there are no red blood cells which are observed. The hemoglobins are generally not present in the urine. Bilirubins is normally not detected in the urine blood, but there may be traces of bilirubin which can be detected in the disease condition. White blood cells are normally not present in the urine. So all these things are normally not present, but if they start coming up in the urine sample, it shows that there is some kind of disease condition or infections which has occurred to that particular patient. Now we come into the second part of the lecture where we discuss about the various blood tests and what the importance of these blood tests are. Now the urine analysis has to be validated along with the complete blood test also. So the blood gives us an idea about the functioning of the body and the various vital organs, how they are functioning, like the livers, how they are functioning, how the kidneys are functioning, how the bone marrows are producing the red blood cell, white blood cells and the various cells. So they give us an idea about the proper functioning of the body vital organs. Now over here, if we see what's the importance of the hemogram or the complete blood picture. So hemogram provide a very wide range or an idea about the disease conditions or the infections the person is suffering from. It subsequently helps to diagnose the various diseases such as anemia, infections, inflammations, bleeding disorders or leukemia, etc. Subsequently, it helps the doctors to monitor the conditions or the effectiveness of the treatment or the drugs which have been recommended to the patient after diagnosis. So this blood test becomes a very important tool in the cancer therapy also. So in the case of the patients who are getting chemotherapy or radiation therapy, the blood tests are also done so that the doctor can know how they are affecting the blood cells or how the other vital organs are functioning. Now if we see in the blood test, the various quantitative measures are calculated, of which few of the important ones are the hematocrit, hemoglobin, blood cell indices and the reticulocyte counts. Now in the blood test, what happens is the doctor the laboratory person takes out the blood, which is the complete blood. Now this complete blood is composed of various parts. The majority part is called as the plasma, then it contains the white blood cells and platelets, and the red blood cells are also present. Now the plasma basically contains the water, proteins, nutrients, hormones, while the buffy coat which is present in between the plasma and the hematocrit contains the white blood cells and the platelets. Now the hematocrit majorly contains red blood cells. So in a normal blood, which is shown over here, in the case of anemia, the plasma level increases while there is a decreased level of the hematocrit. While in the case of polycythemia, which is a disease condition, the hematocrit or the red blood cell number increases while the plasma cell number decreases. So we come into the various red blood cells indices. The first one is called as the mean corpuscular volume, which we generally see in the blood reports. It gives us an idea about the average volume of the red blood cells. So it is calculated as the hematocrit divided by the red blood cell count into 10, and it is expressed in the femtoliter or 10 to the power minus 15 liter. The normal range is generally 80 to 96 FL. Now the next important red cells index is called as the mean corpuscular hemoglobin, which gives us an average idea about the average content of hemoglobin in average red blood cells. So it is directly proportional to the amount of hemoglobin which is present in the person. So the MCH is generally calculated by the hemoglobin divided by the red blood cell count into 10, and this is given in a PG range. So the PG range is 27 to 32. Now this next one is called as the mean corpuscular hemoglobin concentration, which gives us an idea or expresses the average concentration of hemoglobin per unit volume of red blood cell. So it is majorly defined as the ratio of weight of hemoglobin to the volume of RBCs. So it is calculated as the hemoglobin divided by the hematocrit into 100, and it is generally given up in the percentage ratio. So the normal range is 32 to 36%. Now the next important thing which is observed in the the blood report is the amount of reticulocyte count. So reticulocyte is basically the immature red blood cells which are released into the blood one day before their maturation. So we know that the normal red blood cells have got a lifespan of about 120 days, and during that duration of the reticulocytes remains in the peripheral blood for about 1 day. The reticulocyte in a normal person will be about 0.8% of all red cells. So if there is an increase in the reticulocytes number, it immediately indicates that there is a rapid increase in the red cell blood cell turnover in the patient. So the number of reticulocyte released into the blood reflects the amount of hematopoiesis which is taking place in the bone marrow on that given day. Now these various tests gives us an idea about what exactly the things are. Now in the reticulocyte count, as we discussed that this gives us an estimate to the degree of effectiveness of the erythropoiesis. So in the male, the reticulocyte count should be between 0.8 to 2.5, while in the female it should be 0.8 to 4.1. So these gives us an idea how the erythropoiesis process is taking place. Now these various steps, if we see the tabular representation over here, these various tests gives us an idea the number of circulating red blood cells. So the red blood cells gives us an idea about the number of circulating red blood cells in the blood. The reticulocyte count gives us a number of immature red blood cells and how the erythropoiesis process is taking place. Then the hemoglobin count gives us an amount of hemoglobin in 100 ml of blood. The hematocrit count gives us an idea about the packed volume of the red blood cells in 100 ml of blood. Then the mean corpuscular volume gives us an average volume of individual red blood cells. Mean corpuscular hemoglobin gives us a weight of the hemoglobin in the average red blood cells. Mean corpuscular hemoglobin concentration gives us the average concentration of hemoglobin within the red blood cells. Now along with all these red blood cells indices, there are various other parameters which are also checked in the blood report. So a few of the important parameters are the test of the bilirubin which is being done, how much is the amount of total protein which is there, the albumin which is there, the globulin which is there, and along with that the various enzymes such as the SGPT and SGOT test, and the liver enzymes, how the livers and the cardiac cells and the kidney are functioning. Now along with these tests, the various cholesterol levels are also being checked in the blood report. So the various cholesterols which are checked is the total cholesterol, along with that the HDL, which is the high density lipid cholesterol or the low density lipid cholesterol. So the desirable range of these cholesterols are shown over here. So the desirable range of total cholesterol should be less than 5.2 millimole per liter, while the borderline is between 5.2 to 6.1, the high is above 6.2, while the HDL cholesterol desirable limit is more than 1, while the low is less than 1, while the LDL cholesterol is less than 3.3, borderline is between 3.3 to 4, while the high is more than 4 or 4.1 range. So these are the various range of the cholesterol. So from the blood test we can quantify first the red cell indices, then we can quantify the total proteins, bilirubins, albumin, globulin over there. Then we can check whether how much is the level of the cholesterols or the lipids within the blood. Now along with this, the various renal profiles or the cardiac enzyme profiles can be also checked. So in the renal profile, the doctors can check for the sodium, potassium, chloride salts, which are one of the essential salts required in our body. So how these salts are present within the body. Then the creatinine is checked and the urea levels are checked. So creatinine and urea are very important level checking for the kidney functioning, because these are excreted out from the kidney through the urine. So if the level of these urea or creatinine are high in the blood, which shows that the kidney is not functioning properly. So the blood potassium chlorides are also checked. So all these things comes under the renal profiling. Then the cardiac enzyme profiling takes place in which the creatinine kinase is checked, then the aspartate transaminase or AST is checked, and the lactate dehydrogenase is also checked. So the values over here are given. The sodium value is generally range between 136 to 145 millimole per liter, potassium range between 3.5 to 5.51 millimole per liter, chloride range from 98 to 107 millimole per liter, creatinine range from 62 to 115 micromole per liter, urea range between 3.93 to 9.2 millimole per liter. So few of the reports are shown over here, few of the values are shown over here. So the red marked values are generally the low or the high values, while the normal values are shown in a normal color. So this is how the report comes up when we go for a blood test, that the cardiac enzyme values, the creatinine kinase values range between 30 to 200 U by L, then the aspartate transaminase value consists of 5 to 34 unit per liter, then the lactate dehydrogenase value should range between 125 to 243 unit per liter. So these are the various values of the renal and the cardiac enzymes. Now to summarize, these blood tests majorly involves the various immunology, immunodiagnostic tests also. So the drug monitoring is done, then the urine serum proteins are being checked, then in the case of the autoimmune diseases, the testings are being done, endocrinology testings are being done with the help of the blood test, fertility testings are also done with the help of the blood testing. So all these things give us an idea. Subsequently, there are cardiac markers which are there, then the glucose monitoring programs which are there, which helps the doctors to confirm the glucose, how the glucose levels are changing within the blood, how the pancreas are functioning to the production of insulin, or whether the patient is into a diabetic condition. Then the blood gas and the metabolites are checked. Then the routine chemistry panels are being checked, routine urine analysis, pregnancy screenings can be checked with the help of the blood test. Then the coagulations, timings can be checked whether the coagulation is taking place properly or not, complete blood counts can be checked, and the urine toxicology screening can also be checked. So with the help of a single blood test, we can have a multiple number of testing which can be done. So in this testing, which includes the immunodiagnosis, also checking the levels of various proteins which are present within the blood levels, then we can go about the testing of the cardiac markers, also the glucose level, also then the renal enzymes, also cardiac enzymes also. So in this part of the lecture, we discussed about the urine analysis, what exactly urine analysis is, what are the things we check up in the urine analysis, the various forms of urine analysis, which includes the visual examination, then comes the biochemical examination, and finally the microscopic examination. And in the blood test, we discuss about the various red cell indices, the various red cell, what exactly is being checked in the red blood cell counts, and how exactly these red blood cell parameters are. Then what are the renal enzymes which can be checked in the blood, what are the cardiac enzymes, and through these blood test analysis, we can diagnose or tell that how the person is suffering, how the vital organs are working, such as the cardiac cells, or the liver, kidney, or the pancreas for the production of the insulin, or the bone marrow for the production of the red blood cells, or the various white blood cells over there. So with this note, I end my lecture over here. Thank you very much.
Thank you, sir. Thank you so very much. Dear friends, we believe that all the lectures which are conducted for you under the series Medical Diagnostics are very, very beneficial for you. So if you want to give your feedback for this particular lecture, then you can mail us at info.cec@nic.in. Of course, your questions are welcome over here, and the next time when Dr. Amit Bhattacharya will visit our studio, we will definitely try to give answers to your questions. So till then, keep watching us and keep writing to us. We would be meeting again very soon. Till then, take care. Goodbye. Thank you, sir. Thank you so very much.